Hi everyone, my name is June with educator. In our channel, we share positive parenting tips. Follow us now to have more ideas on parenting inspirations. A friend of mine recently asked me what kind of milk is better for her son who just turned 1 year old. It reminds me that one of the top questions for parents is whether their children should drink milk after 1 and what kind of milk they need. Whether to provide milk for their child mainly depends on parents. It may also be based on children's needs or preferences. Furthermore, every child is different and we need to follow their pace. As an educator, according to my knowledge and research, I will analyze several milk varieties today for parents' reference. Hope today's video will help you choose the right milk. Pediatrics suggests that babies should stop drinking formula or breast milk by 12 months of age. Because when they turn 1 year old, they typically eat 3 meals a day plus snacks. Their majority of nutrition transitions from formula or breast milk to food. Continuing to use formula or breast milk can reduce a child's appetite for food and can potentially cause challenges with learning to like a range of foods and textures. However, there are many types of milk to choose from. Here, I am going to give you the 3 most common milk. First, cow's milk. The current dietary guideline for Americans recommends that a child should drink whole milk until age 2 and low or skim after that. Pros: cow's milk packed with brain-boosting protein. Babies need the fat in whole milk for normal growth and brain development. Intake of cow's milk and dairy products is associated with reduced risk of childhood obesity, as well as associated with a neutral or reduced risk of type 2 diabetes and stroke. Furthermore, cow's milk and dairy intake on bone mineral density, but no association with the risk of bone fracture. Cons: cow's milk is not designed for human consumption. Cow's milk contains on average about 3 times the amount of protein than human milk does, which creates metabolic disturbances in humans that have detrimental bone health consequences. Cow's milk and dairy products are pro-inflammatory and mucus-producing. Cow's milk increases the risk of respiratory conditions and allergies. Because it contains high calcium, excess calcium needs to be excreted, and the kidney bear the load, which has a calcium composition. Second, soy milk. Pros: millions of children suffer from some level of allergies related to cow's milk. Soy milk can be an ideal substitute as it doesn't contain lactose protein. Soy milk helps children experience fewer cases of diarrhea and balanced bowel movements, potentially because of soy milk's fiber content. Soy milk contains vitamin D, a vitamin that enhances calcium absorption. Cons: soy milk contains estrogen receptors that may mimic the effect of estrogen and may affect cancer risks related to breast and prostate cancer. Harvard Medical School notes that there's yet to be sufficient evidence to avoid soy milk, and that cow's milk also contains hormones that may potentially be harmful. Last, goat's milk. Pros: goat's milk is easier for children to digest. It contains less allergic proteins. Goat's milk contains higher levels of minerals, vitamin A and vitamin C than cow's milk. Goat's milk has a better protein makeup than cow's milk, making it easier for children to digest. Cons: goat's milk has a very unusual taste and strong odor, which often makes it difficult to ingest. Goat's milk has more calories than other similar beverages. Compared with other types of dairy beverages, goat's milk is more difficult to find and more expensive than other products. I believe that even with these 3 options, many parents will still struggle with product brands. I won't suggest you what brand is the right one, because brands and tastes vary from child to child. Plus, even if you have the right milk, your baby doesn't like the taste and he or she won't be able to drink it. As I mentioned before, each child is different and we need to follow their pace. That's for today. Thanks for watching. If you have questions or thoughts, please leave a comment below. Don't forget to subscribe and follow us to get more. See you next week.